I'm Dr. Warren from Vibrant Life, Oklahoma. Well, I grew up in Northeast Oklahoma, and I grew up in kind of a construction, ranching family. And so there's a lot of hard work, and I would see these different injuries from time to time. And so in doing so, there were visits to the doctor and different things. But as I got older, I had a good friend whose uncle was a chiropractor. And so I was always kind of interested in that. And so I was working out in Lexington, Kentucky, and I'd gotten hurt on a job, and I was could hardly walk and everything. And so I was seeking medical treatment, and my grandma called me and said, hey, you need to, go in and get seen. And so I did, and I had really great results. And so that's really what kind of sent me down that path. So after, I practiced primarily traditional neuromuscular, injuries. And so I became more interested in the wellness side after getting sick. I got pneumonia, and I was hospitalized for quite a long time. And then just being home and trying to recover from it, the recovery was long and arduous. And so I realized I had to do some things to help myself. So I was treating at home and using different IV therapies to get myself back where I was more functional. So it took several years to do that. So I have personal experience with integrated medicine, and what really made it different for me was I was primarily at home for quite a long time and just not feeling well. And and one of my doctors told me that hey, it could be 3 years or 4 years before you're over this, and at the rate that I was progressing, it was probably going to be that long. And so at that point, I decided to do a little bit of research and then think about things that I'd learned in the past and put them into action. And so I started doing a lot of hydrogen peroxide IVs, vitamin C IVs, and different protocols that were applicable for my recovery. I was looking at this 3 to 4 year period to recover from. The surgery was a thoracotomy, and I had about 50 staples to close it up. So it was really a bad deal, and so the recovery would be slow and ongoing, and working was really difficult. So really, in about 6 months or a year or so, I was able to get some tissue healing and recovery, get my strength back, and be able to get back into practice. And that's what really opened me up to more integrated therapies and stuff. I always used a little bit of it, but to true integrated medicine is sort of a combination of all of it together, and really you need a protocol and a plan in order to get to an outcome that you're looking for. There's a couple differences. Like again, I don't have a one size fits all scenario, and it's not just neuromuscular adjustments therapy. So these therapies that I use, I've experienced. I can tell them what they can expect to have. Some therapies don't work on all patients. So the real difference is they have a variety of protocols that's at their disposal. And then, quite frankly, another difference is if I can't help them, I usually know who can, and I don't mind sending them, wherever they need to get help, because you're still going to get credit for getting them where they need to go. So those are probably some of the differences. So customized care. We're going to start with the history with them, so we understand where they started, and then a little bit of information about where they want to go and what their expectations are. Because some people, they just want to get to feeling a little bit better and, get back to work. You get another brand of patient who, they want to feel great and be better than maybe they've ever been before. And so so we're going to have a protocol or a plan for you that's going to respond to what your desires are, and then what I think is going to get you there and get you to your optimal level. So if there's a patient watching who's been in pain for years, give us a call. We'd love to get you treated and get you back to an optimal life.